Welcome to our presentation on nursing professional policy. I'm Sansan Weber, and my teammates are Megan Mueller, Teresa Borelli, Jessica De Jesus, Catrice Miller, and Aidan Lisney. We are going to take you on a journey today, beginning with the birth of the nursing profession and ending with developing a voice and being an advocate in the nursing field. We will start with Megan, who will talk to you about how nursing became a profession, what policies are, and why policies are important.
Hey everyone, it's Megan. I'm here to talk to you about Florence Nightingale and the birth of the nursing profession. Florence was known as the Lady with the Lamp. She was a pioneer of public health and the founder of modern nursing. She improved sanitary conditions through the Crimean War, implementing procedures to increase health. She insisted patients have fresh food, water, air, and laundered linens and bandages. She reduced the death rate in war hospitals by 2/3. She was a reformer and advocated for public health. When she returned from the war, she continued to improve the conditions of hospitals and presented her experiences and data to Queen Victoria and Prince Albert, and helped to form the Royal Commission to improve the health of the British Army in 1857. As a result of her observations, the environment theory of nursing was born. Nightingale explained this theory in her book, Notes on Nursing: What It Is, What It Is Not, which was published in 1859. The model of nursing that developed from Nightingale, who is considered the first nursing theorist, contains elements that have not changed since the establishment of modern nursing profession. Though this theory was pioneering at the time it was created, the principles it applies are timeless. Her book focuses on taking care of the patient's environment in order to reach health goals and cure illness. In 1860, she opened the Nightingale Training School at St. Thomas Hospital in England. This landmark event signaled to the world that nurses required schooling for the work that they did, and provided one of the first opportunities for women to work outside of the home and be self-supportive. Nursing as a profession would not be where it is today without her. What are policies and procedures? A policy is a guiding principle used to set direction in an organization. It is a principle that top executives agree their organization will abide by, and a clear rule that leadership is always prepared to stand behind. A policy is a solid set of instructions and determines present and future decisions. It also aids decision-making under a given set of circumstances. Policies are usually based upon accepted, well-defined norms or standards of practice. The organization's procedures support these rules. A procedure is a series of steps to be followed as a consistent and repetitive approach to accomplish an end result. They explain how the policy is achieved or how it should be carried out. Procedures clarify how to accomplish something in a series of steps that are to be followed in a specific order, providing step-by-step instructions for routine tasks. To give an example, a policy on an indwelling urinary catheter outlines who can perform it, guidelines for when it should be inserted and removed, and how frequently it should be assessed and cared for. Whereas a procedure outlines the equipment needed and the step-by-step process of inserting and caring for and removing the catheter. There are policies and procedures for everything we do as nurses. When we give medications, when we insert an IV or a urinary catheter, or document patient care. Policies and procedures in healthcare are far more than just general guidelines. They set expectations and proper ways of doing things. They guide day-to-day activities, help promote consistency in practices, reduce mistakes, and keep patients and staff safe. Why do we have them? We have policies and procedures to guide patient care and lay the groundwork for a foundation. Policies provide a framework for employees by outlining expected standards for day-to-day operations and help facilities meet the ever-changing health, safety, and legal regulatory requirements in our high-risk industry. Every facility's needs are different based on the type of care that they provide. Therefore, they need to have their own set of policies and procedures. They have to follow laws when implementing and revising policies to receive funding, regulation, and training. For every new law or regulation, new or updated policies must be created and distributed to the staff. They provide uniform information for all employees so that they can do their jobs well and there are no discrepancies. They also promote compliance with regulations, statutes, and accreditation requirements. Why is it important to have policies? Policy in healthcare is vitally important as it sets a general plan of action used to guide desired outcomes and is a fundamental guideline to help make decisions. The purpose of healthcare policy and procedures is to communicate to employees the desired results of the organization and standardize practice across multiple entities within a single health system. They help employees understand their roles and responsibilities within that organization and serve as a resource for staff, particularly new personnel. In the healthcare environment, a policy should set the foundation for the delivery of safe, cost-effective, quality care. Policies and procedures are essential in providing clarity, guidance, and standardization. They improve productivity, efficiency, and protect organizations by minimizing liability. They help to ensure the protection and safety of staff, patients, and the organization as a whole. Written policies can prevent chaos, confusion, and legal issues. The need for these policies is evident when it comes to the impact on healthcare delivery. They enhance patient care and outcomes and improve safety by minimizing harm to patients. Nursing impact on policies and procedures. As nurses, we're expected to identify issues and work with other decision makers to advance healthcare policies. If we as individual nurses see an issue in our institution, we can advocate for our patients by conducting evidence-based research and presenting it to our organization on ways that we can better care for our patients. They will then evaluate it and make a decision. The American Nurses Association efforts are directed at those responsible for creating the modern U.S. healthcare environment, the policymakers and agencies whose decisions will affect patients and those who care for them. They are dedicated to ensuring that the voice of nursing is heard at all levels where these decisions are made. To give an example of what nurses are capable of, take two registered nurses who worked in an OR in New Jersey, Jennifer Pallotta and Joan Bonovic. They read a study that found a large proportion of OR products could be recycled. They used an evidence-based approach, consulted with a medical waste company, and developed a plan that led to significant savings. Another positive outcome of their study showed that a 50% reduction in biohazardous waste that costs on average 10 times more to dispose than other wastes. These nurses advocated for change in their workplace and made a difference. Nurses who influence policy help shape the care that we provide today and tomorrow. So we talked about Florence Nightingale's influence on nursing, what policies and procedures are, why we have them, and why they're important, as well as nurses' impact on policies. Now I'm going to hand it over to Teresa to discuss how policies are developed.
Hi guys, it's Teresa and I'm going to talk about policy development. For looking into policy development, first we're going to look into what shapes a policy. Values. A policy reflects which value or value is given priority in a specific decision. Also with values, you must take into consideration that different people value different things. So with policy choices, it can bring a disadvantage to some while others will gain something from the policy. And having a valid judgment to support or oppose a policy is important. Policy analysis and analysts, here by examining the problem and breaking it down to better understand it, assessing the policy and finding alternatives, and critical thinking plays a key role in policy shaping. By critical thinking, the issues helps identify how groups can act, evaluates alternatives, and determines the policy choice that is most desirable. Politics can play a role in shaping the policy. They can influence policy by indicating there are opportunities to shape the outcome of the process, and also offer resources like financial and human resources. So politics and political action can be viewed as the efforts and strategies used to shape a policy. Next, interest groups. Here they advocate for policies that meet the goal of their members or organizations and can help reach a larger scale of supporters for their goal. Science and research. Scientific findings can play a powerful role in the first step of policy process, getting attention for a particular problem and moving the problem to the policy agenda. Research can also be valuable in defining the size and scope of the problem. And last, the media. They can help get information out to the public and bring light to the issue at hand. Next is the policy process. It can be broken down into 6 steps. First, problem identification. Second, policy analysis. Third, strategy and policy development, followed by policy enactment, implementation, and evaluation. The steps of the policy process can be broken down. First step is identifying the problem. Here you clearly identify the problem or issue you're trying to address. Who does it affect? How often does it occur? And how serious is the issue you're addressing? Next is policy analysis. Research possible options relevant to the problem or issue you have identified. This can be done by reviewing literature on the topic. Also here describing how it impacts the targeted audience and addressing the cost to implement, and comparing costs with benefit can be a big factor. Assessing and prioritizing the options by including evidence that addresses alternatives and opposing points of view on the issue. Third is strategy and policy development. Once a policy solution has been prioritized, the next step is to define a strategy for getting the policy passed and implemented. By identifying how the policy will operate and what steps are needed for policy implementation. Here is where the drafting up of the policy is developed. Step 4 is policy enactment. Here you follow internal or external procedures for getting the policy endorsed or passed, looking at laws and regulations that need to be followed. Next, implementation. Getting the policy into action and monitoring the progress and ensuring full implementation occurs. And last is evaluation, where you assess the impact and outcomes of the policy and use evaluation results to inform the evidence base. The overview of the policy process can be compared to the nursing process, where nurses assess, diagnose, plan, implement, and evaluate. So when you start your new career as a nurse, keep in mind that you can make a change where you notice a change is needed. And knowing that you already know the foundations of policy process from the nursing process, it may help aid you in taking action to make a change, no matter how big or small it may be. Areas where nurses act to influence policies: the workplace, community, associations and interest groups, and the government. In the workplace, nurses work in a variety of settings, like hospitals, clinics, schools, nursing homes, and home health agencies, and many more. Policies guide many activities in the healthcare workplace where nurses are employed, many that affect nursing and patient care, like staffing policies, clinical procedures, and patient care guidelines. For a community, it may be a neighborhood, a city, an online group with a common interest, and even a faith-based network. Nurses can be influential in communities by identifying problems, strategizing with others, mobilizing support, and advocating for change. Nurses can serve in elective or voluntary positions that influence the policy, such as parent-teacher associations, planning boards, and local organizations. With associations and interest groups, many professional nursing associations have legislative or policy committees that advocate for policies that support their members' practice. Working with a group increases the chances for advocacy to be effective, provides an environment where resources can be shared, and enhances networking and learning. For example, the American Nursing Association. Also, for interest groups, some can have a broad area of policy interest, while others focus on one disease, like breast cancer. And the government. This can be any level, from local, state, or federal. Government actions and policy affect us from birth until death. Though most healthcare in the United States is provided in private sector, much is paid for and regulated by the government. So how the government crafts health policies is extremely important. Here, nurses can serve in federal, state, and local agencies. They can serve as electing officers. Also, they can communicate to policymakers their support or oppose a policy, and provide testimony at government hearings and open meetings. How nurses can be effective in policy development. Knowledge and lifelong learning. There's many nursing school programs in different levels that nurses can take to get more educated on policies. Nurses, and to help identify problems, research and understand the subject plays a role. Communication is a big factor. Talking to others, getting their points of view, and seeing where their other issues need to be addressed. Volunteering and getting involved. And last, taking action. When there's an issue you see or problem and you think you have a way of solving it, speak up and talk to people to see how you can get a policy developed.
Now that we described what policies are and how they are developed, Jess is going to present on policies surrounding continuing education requirements necessary to keep our licenses once we get them.
So most states require to complete some form of continuing education every 2 to 3 years in order to maintain their licensure. Not all states require continuing education. About 12 states don't require it, but it could be required by employers or nursing associations. Some states only have a one and done requirement. So when you graduate, you do 10 hours and that's it. Continuing education is also common in specialty certifications. Hours required for specialty certifications and state are separate. For example, your state might require 20 hours of education, plus your certification might require 10 hours. In total, you would need 30 hours of education. They don't overlap. Some states require specific topics to be addressed within your continuing education. Besides that, it's your choice. Doing extra hours of continuing education does not carry over to the next renewal period. It resets every 2 to 3 years, depending on your state's renewal period length. For Pennsylvania, the RN requirements are 30 contact hours every 2 years. There's also a mandatory child abuse requirement, training on child abuse recognition and reporting. For initial license, 3 hours of the child abuse requirement is required. For renewal, 2 hours are required. And the provider of the education training will submit the results to the Pennsylvania State Board of Nursing. So I just want to talk about continuing education units for a second. Continuing education units are also known as continuing education credits, and they reflect the time spent participating in educational activities. One continuing education unit is equivalent to 10 hours of activities. So acceptable continuing nursing education, according to the Pennsylvania State Board of Nursing, acceptable continuing education must be relevant to patient care or professional nursing in a general or specialty area and enhance the knowledge and application of the physical, social, biological, and behavioral sciences. Acceptable types of continuing nursing education are board-certified programs and activities. Skills activities, for example, advanced life support is a common one. There are seminars, professional development events, and academic courses. Zoning into academic courses, courses must be related to nursing. One trimester unit is equivalent to 12 continuing education hours. One quarter unit is equivalent to 10 continuing education hours, and one semester unit is equivalent to 15 continuing education hours. These continuing education hours are the same regardless of the degree program, bachelor's, master's, doctorate, etc. Requesting approval of an activity that is not board certified is possible. The request needs to be submitted to the Pennsylvania State Board of Nursing with a fee at least 90 days prior to the course, so that way they have time to review it. The fee is $115 per continuing education hour requested. So if you have a course that you're interested in and it's not board certified, you can apply for it, but if the course is, let's say 3 hours, that would be $115 times 3. And you want to make sure you do that prior to the course beginning. So fulfilling continuing education requirements, remember, it can be fun. It's good to space it out though. Courses are offered in person or online. There are board certified seminars and professional events, which is a great way to network and scope out employment opportunities. There are some continuing education providers that even offer their seminars in the form of cruises or tropical getaways, which sounds awesome. Nurse.org recommends to choose your continuing education hours carefully so that you can get the most out of the experience, whether it's networking with fellow RNs at a conference or learning a new skill that can be directly applied in your day-to-day job. So paying for these continuing education courses, first you should ask your employer or union because some offer free continuing education to their employees or members. Also, for additional free education, check out nursingce.com. Currently, they're offering COVID-19 continuing education course for free, but they also have a lot more on there. You can also find a lot of courses that are under $50. Some providers offer flat fees, so you pay a certain amount, you get as many hours of continuing education as you want for a certain period of time. There are even scholarships available for continuing education courses. Also, I wanted to mention courses can be written off as a tax deduction when filing taxes. So, records of continuing education hours. Keep all records of continuing education courses, including certificates, receipts, online notifications, etc. The Pennsylvania State Board of Nursing recommends keeping records for 5 years in case credentials are audited. Some employers offer electronic databases to log continuing education hours as well.
We will all soon be earning our nursing license, and now you know the continuing education requirements needed to keep this license. Another area of focus for us newly graduating nurses is entering the workforce. Catrice is now going to present on how policies will impact us in the workplace.
Hello, my name is Catrice Miller, and today I'm going to describe a few of the various effects that policies have upon healthcare delivery in acute and community-based settings. So, what do we mean by healthcare delivery? To put it plainly, healthcare delivery is the provision of treatment to promote well-being. This basic definition encompasses both the action of providing the care to the patient as well as facilitating access to the care. Healthcare delivery can occur in many places, but as stated previously, today I will focus on acute care and community-based settings. Healthcare delivery in acute care settings focuses on the evaluation and management of the individual patient. The main goal is to provide a diagnosis and to treat it. Acute care generally operates on a medical care pattern of disease-specific treatment. This treatment typically occurs primarily in hospitals, emergency rooms, urgent care facilities, doctor's offices, and surgical centers. Conversely, community-based healthcare delivery focuses on the health of its entire population. Strategies are concerned with disease prevention and health promotion. Interventions in community-based settings tend to place emphasis on educating the residents of the community while adhering to regulatory policy. The settings for community-based healthcare delivery can be anywhere within the community, including but not limited to schools, workplace environments, community health fairs, and community health centers. Healthcare delivery policies in acute care and community-based settings are similar in that they both follow federal and state laws. The policies differ in focus. While acute care policies are generally standardized, community-based care policies can vary from organization to organization. In acute care policies, they are set to create a general plan of action used to guide desired outcomes and is a fundamental guideline to help make decisions. Community-based policies create initiatives that are directed to address community health disparities and aid in changing the determinants of health. The important factor to consider is that acute care settings most often provide treatment after the disease is present. The aim of community health settings is to affect the patient at the primary level of prevention to avoid development of disease before it occurs. Regulations that influence healthcare delivery policies. There are many regulations that can influence healthcare delivery. I decided to focus on 4 of the more common, yet very important regulations that influence healthcare delivery today. First off, I'll talk about the Health Insurance Portability and Accountability Act of 1996, or HIPAA. HIPAA establishes boundaries on the use and release of health records. It also outlines safeguards to protect patients' information and establishes civil and criminal penalties for violations. HIPAA applies to verbal, written, and electronic patient records. Now that I've spoken about HIPAA, we move on to high tech. The High Tech Act was born of the need for protection with regard to electronic health records. Advances in technology with the increasing use of electronic health records led to the creation of the High Tech Act. It mandates audits of healthcare providers to determine whether they follow HIPAA privacy rules related to privacy and security rules. The High Tech Act has been called the teeth and claws of HIPAA. Because health records, unlike credit cards, can't be canceled, changed, or reset if there's a breach, healthcare providers have increasingly become targets of hackers. Next, we are going to speak about the regulation regarding the Medicare Access and Children's Health Insurance Program, or MACRA, of 2015. It's another important regulatory factor of healthcare delivery because it directly affects the patient's ability to access care. Unfortunately, the inability to pay can keep patients from seeking care when they really need it. The MACRA Act ensures that providers are paid using a value-based algorithm. And last but certainly not least is medical necessity. Medical necessity is one of the most important parts of healthcare delivery. As nurses, we live by the unwritten rule that if it isn't documented, it didn't happen. The same rings true for the rules of medical necessity in a sense. Essentially, it means that if the procedure is not medically necessary, it will not be paid for by insurance companies. All of these regulations can influence policy development and implementation in both acute care and community-based settings. It is one of the professional nurses' many responsibilities to adhere to and abide by these regulations when providing care. The professional nurse's role in healthcare delivery is multifaceted throughout all of the responsibilities required, but competent communication is a key skill. The nurse must communicate with all members of the care team while focusing on providing the best patient care possible. This communication must adhere to the standards set forth by the policies in place according to the setting, whether acute care or community-based. Lillian Wald, a nurse and human rights activist that is known as the founder of American Community Health Nursing, said, "Human interest and passion for human progress break down barriers centuries old." It is a warming thought that her words still ring true today.